Earlier this week, I met Dr. Salia. She's a fantastic frontline doctor, and she explained some of the burdens that she and her fellow doctors face in doing their incredible job. And the decision I've taken is to strip away the bureaucracy, to abolish NHS England and push power and resource to the front line to deal with some of those burdens that were set out to me earlier this week. And that'll allow the NHS to focus on getting those waiting lists down, which I think across the country is what people most want their NHS to do. Well, Dr. Salihad, thank you so much for coming in for this conversation. We want to talk about the NHS, which I know for you is personal. You're a doctor at one of the London hospitals. I think I'm right in saying that your husband's a doctor as well, so it's clearly in the family blood. It's personal for me as well. You may know that my mother was a nurse, very proud nurse as well. My sister was a nurse, taking after my mother. My wife works in the NHS in one of the London hospitals, and her mum was a doctor. So these things are very personal, obviously, for your family, but also for mine. But it is also a central mission of this Labour government to, if you like, pick up the NHS and put it back on its feet, but also make it fit for the future. We're really proud of the fact that we created the NHS in the first place, but I want to envisage a situation where in decades to come, people point back to this government to say that was the government that put the NHS where it needed to be for decades to come. Now that, to my mind, is not going to happen if we don't change. We need to have an NHS that is much more based on preventative issues, that is closer to where people are, but also where we strip away some of the bureaucracy and make much better use of technology and AI and all the things that are being used elsewhere but aren't being used enough in the NHS. And the reason I wanted to talk to you is I think you've got some really great ideas in this area, and I think they're probably born of some frustration. So what are your frustrations and, please, your ideas?
Of course. I've been a doctor now for over 12 years. My family is all medical as well. My mother, my father, my brother, my sister.
It really is in your blood.
It really is, yeah. And we all care very deeply about the NHS, really, really deeply to our core, you know. I think one of the key things that we see in the NHS is the difficulties with everywhere not being completely electronic.
Yeah.
So I'm very lucky to work in a trust where we're almost completely digital.
So it is a bit patchy. Some places we're doing it well, but not
Absolutely.
others.
Correct. So it looks different in different places. Some places are completely digital, and other places are partially digital. So some of the offering will be digital, but other parts of it, maybe they'll still have hand prescribing, or another aspect of it will be non-electronic. Now the trouble with paper records is when I'm seeing patients, particularly in the emergency department, I need information, and I need the right information. I need it at the right time and in the right place. And when you have electronic recording systems, it's much easier to gather the information. But electronic recording systems aren't just in hospital. It's about being able to link up to GPs and mental health services and really get the full picture for our patients.
So what would your message be for our government, for me and for the Health Secretary, for the whole of the government? What would you say? You're there on the front line, you want to innovate, you want to change, you're frustrated. What would you say to us to keep in mind? Because politics is about policy, but it's also about who do you keep in your mind's eye, what are you really thinking as you make your decisions? What would you want us to think about as we're making decisions about the future of the NHS, the future of the delivery of care in this country?
I mean, it's a big question, isn't it? But what I would say is we love the NHS and we want to innovate in the NHS. I speak for myself. I would love to be able to innovate and make as many changes as possible. But we also need to be given the tools to be able to do that. And we want to bring our ideas to the table and help make the NHS the best version that it is. And I think the more that we listen to ideas of all healthcare professionals and try and implement them rapidly, maybe even using digital technologies, the better we're going to be for it.
My sense is we can make much better use of digital technologies and AI. I've seen these brilliant examples
Yes.
Of AI with a stethoscope that is able to predict if someone's going to have a heart problem,
Yeah.
particularly people who are sort of 50, 60 years old, so get ahead of anything that might happen to them. But I saw it in one trust, but it wasn't necessarily being rolled out in all trusts, which is a bit frustrating. But AI could be a game changer, couldn't it?
We have to do AI, but we have to do it responsibly. But it has a fantastic role to play. In particular, we can think about clinical role, like you mentioned, the stethoscope.
Yeah.
We have other things like technologies being developed in AI to look at electric recordings of hearts in women and work out whether they're at high risk of heart disease.
Right.
We have, so that's research purposes. There is administrative roles that AI could play as well, potentially. And certainly at my trust, what they're doing is a pilot studies where junior doctors are actually involved as well.
Okay.
Yeah. And what we're actually trying
So
to
it's directly inputting into what's happening.
Yeah, so what they're doing is trying to, instead of spending ages writing summaries when a patient's discharged from hospital, they're working with junior doctors to see if they can develop some technology whereby all of the existing patient data can be summarised and a summary can actually be produced at the touch of a button, which is just fantastic, isn't it?
So I can see you think sort of the innovation, the change, the better use of technology and data is definitely the way we should go in terms of changing for the future.
I think it's a huge strand.
And your strong feeling is, I can tell from the way you're arguing it and putting it, that NHS workers are up for this and they want to innovate because they care passionately about providing the best care.
Yeah, I think the whole world is moving from analogue to digital, isn't it? And actually the NHS will have to basically keep up, and we do need to run towards this digital age and make sure our NHS hospitals function digitally. And AI is a huge part of that and has potential to make our life a lot easier on the shop floor as physicians seeing patients. But of course, it has to be done responsibly and safely.
Fantastic. Can I say thank you very much for doing this conversation, but also thank you very much for everything you're doing in your role as a doctor for so many people who will be affected by what you do. Thank you.
Thank you.